Hi, I'm Philip Chameau, rhinoplasty surgeon. What are some considerations in choosing a rhinoplasty surgeon? Rhinoplasty is an important decision. Permanently changing your facial appearance slightly or significantly, it's a big step. Doing your homework research is important, but not insofar as educating yourself on different techniques, open, closed, preservation, ultrasonic and so on. This is very confusing and it's often counterproductive, even for those with some medical background. It's like researching construction techniques to choose a builder for your home. A good surgeon will usually be well versed in the various approaches and discuss these with you. What can be helpful is speaking to others who have had a rhinoplasty, your family doctor who has referred others and seen the results, and sometimes those who have some knowledge of the rhinoplasty industry. Surgeon reputation and experience really count. Read Google reviews, good and bad if that's your thing, but be aware that it is on the internet and many of these are not verified, they're not real patients or not without motive necessarily. Please be mindful of the fact that many of the most negative reviews come from patients you decline to operate on. Surgeons don't say no without good reason, but it can still make people very unhappy, and so saying no doesn't make you a bad surgeon. Verified online reviews from endorsed sites can be more helpful. At least you know the comments have come from a real patient. Look at a surgeon's posted results. It can give you a good idea of whether they've experienced doing noses like yours and whether you like a similar sort of aesthetic to the surgeon. So, if you've shortlisted several surgeons, look at their training and ongoing commitment to the specialty, teaching, presenting, research. They don't have to be a leader in their field, but keeping up to date is important. The specialty's changed a lot in the past 10 years. The more experience a surgeon has, the greater likelihood you'll achieve your desired result, especially in complicated noses or revision. But this experience may come at a higher cost, and certainly not everyone's nose requires a subspecialist rhinoplasty surgeon. The age-old question, should I see an ENT or a plastic surgeon? In the world of rhinoplasty, this really doesn't matter, as long as they are adequately experienced, and at present, our world leaders and innovators in this field originate pretty equally from both specialties. In Australia, it would be fair to say that many ENTs have their foundations in functional rhinoplasty to optimise breathing, and then some may gain further experience and training in cosmetic work, which has been my journey. And the plastic surgeons that do rhinoplasty often focus on just cosmetic work, although many are well versed in functional concepts, especially from a craniofacial background. In reality, for the experienced rhinoplasty surgeon from any specialty, functional and cosmetic concepts really go hand in hand. You can and should seek a rhinoplasty that achieves a good-looking nose, that breathes well and continues to breathe well, and is structurally sound enough to achieve a long-lasting result. A cosmetic rhinoplasty shouldn't compromise your breathing or lose support, and a functional rhinoplasty doesn't need to result in a bigger, broader nose. All right, moving along. When you meet your surgeon, how well do they communicate? How relaxed do you feel? How engaging are they? Do you feel you can openly express yourself? How comprehensive is the aftercare they offer? Does your surgeon mention nasal function? Because causing nasal blockage problems is a real problem following some cosmetic procedures where structures not kept in mind. Do you like your surgeon? It's not essential, but rhinoplasty is an elective procedure, and the post-op recovery is months and several visits, so it's nice and it's helpful to have a good rapport with your surgeon. Also important is initially how organised and thorough are the reception staff. They're going to be your port of access to your surgeon. Do you trust your surgeon that they're able to deliver on your expectations, that they've explained everything to your satisfaction, and that if something goes wrong, because surgery carries some unknowns, that they'll be there to support you? Some degree of trust is essential, or you've got a really rocky road ahead otherwise, and even if everything progresses normally. Get multiple surgeons' opinion if you think it's going to be needed. It will help with your confidence and knowledge in the end, but not everyone needs to. Try to be as realistic in your expectations as possible. Try as best you can to distinguish hype and marketing from genuine information. Filters, online image morphing, unusual beauty trends can make navigating this space really complicated, especially in younger patients. Bringing a family member or trusted friend to consults can be really helpful. All right, going overseas for cheap surgery is an absolute lottery. Price is important to many, but be aware what the risks are. Every country has cheap and expensive surgeons, good and not so good surgeons. But for some of those patients who are back home trying to manage a bad post-operative complication or even get some routine aftercare advice, life can become very, very difficult. It's an elective operation, so take your time. There's much to consider beyond price. Your best chance at getting your best result is your first rhinoplasty, primary rhinoplasty. Revision surgery can be at a whole nother level of complexity. Most surgeons don't perform it. There can be a lot more healing unpredictability, bigger surgery, longer recovery, more expensive, and sometimes compromised results. It's really worth avoiding, so it's really worth finding the best surgeon for you, for your primary. Anyway, hopefully some of the above has helped. Rhinoplasty can have a huge positive impact, but it's a hard operation to do well, so finding the best surgeon for you is important. Good luck.